go.
My name is Brittany Whitworth, and I have the opportunity of visiting the College of Nursing, and my mentor was Julie Schwein. And my title is Stigma Epidemic: Association Between Lack of Knowledge and Stigma Among Mentally Ill Patients. So people believe that mental illnesses are really rare, but in truth, 1 in 4 people have them. And the reason most people don't talk about it or say that they have them is because the stigma created by the people who don't have them. Okay, so these are a list of mental health disorders. The most commonly known ones that you guys might know are anorexia, depression, anxiety disorder, and ADHD. And treatments include seeing a medical doctor, a psychiatrist, psychologist, and there's also medication. I have a quick clip. Before I played this, I don't know if any of you seen the movie The Soloist, but it's about this man. It's about this man, and he went through life normal, and he had a journey. He was going to school for being a violinist, and then suddenly he started developing symptoms that he found out were mental illness, and he didn't get any treatment for it. Sorry. I'm just going to skip a little bit of it. Sorry. So you guys didn't see the beginning of the part, but he was going to play, and he was going to sit on the chair, and he decided to sit on another one because he couldn't decide. And they were laughing at him and he felt really uncomfortable his first time playing in front of an audience with this condition. And so he started having flashbacks, and it created he started getting really upset, and he didn't realize where he was, and so he acted out angry. And I showed this clip because it's part of stigma, so media representation. Most people believe people with mental disorders act this way, but in truth, it's not this severe. There are cases that are this severe, but not everyone acts this way. So I have some myths about it, and it's people who have a mental health disorder can never be a stable person of society. They're fundamentally unstable, unpredictable. They may be dangerous to people around them, and this is going to seem far out, but some people believe that they were even possessed by evil spirits or cursed, and that they have this disorder because it was for moral wrongdoing. Back then, mental illness was seen as everyone was outcasted, was seen it. And so they didn't have the treatments like we do today, like I mentioned before, the doctors and medication. So they were basically put in an asylum. You guys all know what an asylum is? They put into a medical housing. And I wrote down the word stigma because I don't know if you all know what that means, but it's a mark of disgrace associated with a particular circumstance, quality, or person. And then mental illnesses are medical conditions that disrupt a person's thinking, feeling, mood, ability to relate to others, in daily functioning. So I got my study approved by my mentor and Ms. Meister, and I was going to investigate how much knowledge people obtain about mental health and how they are influenced by media representation. So this is my survey. I basically asked if they feel comfortable how much knowledge they gained in learning environments, and how often do they feel the media depicts people with a mental disorder. And my results were that about 90% of people said they felt uncomfortable around people with a mental disorder, and that about 85% feels that the media depicts them in a wrong way. So that was basically just about my survey and how people today rely on media. So instead of going to look up research themselves, they'll like see it on the news or other things, because people who talk about mental illnesses, like the news, for instance, like I just said, or movies, they want to keep things interesting because they need people to watch it. So they might depict that person in a wrong way that seems more interesting to everyone else. So my solutions is that I would have a representative come into a classroom setting and talk about maybe once a month about mental illnesses and stigma. And I figured if more people know about it, then we could start a group, and then that will cause more people to target like media, like journalists, news reporters, movies, and that will make them depict people with mental disorders in a right way. Any questions? I don't know if you guys want me to read that. Can you guys see it? Okay, sorry. It says, hi, it's really weird. It's supposed to be funny. Hi, Brittany, may I have the jewel of without physical confrontation, please? And he said no. So he's like outer space. He's trying to get the jewel. And then it said some conversations are scary. And then it said some aren't. Hi, Dave. How are you feeling these days? A lot better, G. Thanks for asking. So basically, he's saying out there, like some conversations up there. Obviously, that was hard. Maybe he's asking an alien for a jewel. And then down there, some people feel it hard to ask other people about a mental disease or how they're feeling. And so that's why it says somewhere. So that is.
You said that there's a lot of people, there's people that don't understand, I guess, mental illnesses. How do you feel about that? What way do you think people should understand about people with mental illnesses?
I feel that people should research or try to understand more about the mental disorder away from what they see on the media or all the bad representation they see. That way they can learn more and feel comfortable talking to them.
Can any mental disease be cured? Are they curable?
Curable? Well, they have medications that maybe like slow down the process or like make you like feel like stable, but it's not like